I would like to thank you for listening to this presentation about universal healthcare. To begin, universal healthcare is a need in the United States. However, there are issues in achieving this and allowing every U.S. citizen to afford healthcare. The point of this presentation is finding and creating a solution for healthcare to be affordable for everyone in the United States. The history of universal healthcare began in the early 1800s. In Germany, in the early 1800s, they created the sickness insurance. Sickness insurance was created due to the need to stabilize citizens' income by protecting them against the loss of wages from sickness rather than having to pay medical expenses. From that point on, the topic of universal healthcare spread throughout Europe in places such as Scotland, France, and Denmark. Then in 1965, Medicare and Medicaid was created in the United States. Medicare is defined as the federal health insurance program for people who are 65 years or older. Certain younger people with disabilities and people with end-stage renal disease are also included in the Medicare program. Medicaid is the largest source of funding for medical and health-related services for people with low income in the United States. Ellen Grayson stated that 45,000 people die per year because they are unable to afford health care. We would like to solve this issue in allowing every U.S. citizen to afford health care. Brandon will describe more in detail our proposal for this solution.
Hello everyone, here's a little bit of background on our proposed plan. Our plan, as Brittany mentioned, is to create a bill that will be passed through Congress and placed into effect. The purpose of the bill is to eliminate the prevention of selling insurance across state lines. In November of 2012, the Republican Party drew up a bill to present to Congress, but it was stalled by the Democratic Party. The current Affordable Care Act has been decreasing in popularity since it's been enacted. For our three alternatives, we decided to choose the first being equal tax treatment between out-of-pocket and employer-purchased health care. The second option is to change Medicare from a reimbursement service to a defined benefits plan. And the third option is to open borders between states for insurance companies, increasing the supply and decreasing the cost of health insurance. In order to gain the equal tax treatment between out-of-pocket and employer-purchased healthcare, there are two options. Either make the healthcare benefits provided through employers taxable, or making the payments of out-of-pocket healthcare expenses and the purchase of personal health insurance fully tax deductible. With our changing Medicare from reimbursement service to defined benefit plans, Medicare recipients would receive specific amounts each year. Funds not used can be rolled over for the following year. This will also increase freedom of choice for Medicare recipients. Our open borders plan will not only break up government-protected oligopolies, but it will increase competition within the health insurance industry. It will expand options available to consumers and will allow more personal plans. We used three methods to determine the most feasible plan. We used interviews, surveys, questionnaires, and academic reports. We are going to conduct interviews with insurance company representatives and highly respected economists. We will conduct surveys and questionnaires on members of the upper class, middle class, and lower class from all regions across the United States. We will use qualitative data for academic journals and reports to determine the best solution. The cost for open borders is there's government involvement, companies will have to downsize in order to compete, and companies that cannot downsize are forced into bankruptcy. However, the benefits for open borders are lower cost of health insurance, higher competition among insurance companies, and the removal of oligopoly within the states. The cost for the equal tax treatment plan is that there will be taxes on the benefits of the healthcare plans purchased through employers, and that this plan will have little value to taxpayers with low incomes. However, the benefits are that there will be an equal incentive to purchase either out-of-pocket or through an employer. For the plan of changing Medicare from a reimbursement service to a defined benefit plans, the cost are there is limited funds, and once the funds are used up, the remaining expenses are out of pocket. The benefits for this are all excess funds can be rolled over for use in following years.
Once again, I'd like to thank you so much for listening to this presentation. In conclusion, I'd like to ask you, does our recommendable plan sound like a good option for the United States? To recap, our recommendable plan is to open borders between states, increasing supply and decreasing cost. Another question is, what can you do to influence and involve yourself in the healthcare movement? You could talk to your senators and representatives of Congress to get your opinion heard. And you could also partake in the survey for a study, which will be having a survey for each region in the United States to get a representative sample of the citizens of the United States. We look forward to working with you and hearing about your opinion in the near future. Again, thank you so much for listening to this presentation.